The situation of this patient is something like that patient comes with acute low back pain, gives us history of lifting some heavy box, and while assessing we find out that all the lumbar movements are causing exacerbation of the pain, as well as we notice one more thing, that patient is sitting with lumbar flexion or standing with slight lumbar flexion feels comfortable in this position. And now we need to find out from the given option that what can be the correct diagnosis for this patient. And the option given to us are: option A says that herniated lumbar disc, option B says that facet joint dysfunction, option C says that ankylosing spondylitis, and option D says that it is SI joint dysfunction. Now let's start with the option A, which says that lumbar disc herniation. So let's first understand what are the important points given in the question. The point number one, that patient has history of lifting something heavy which has caused acute back pain. Point number two over here is that patient is having radiating pain on both the lower limbs. Point number three over here, when we were assessing, we found out that any lumbar movement is causing the symptoms, aggravation, exacerbation of the pain. And point number four over here is patient feels comfortable when they are sitting with slight lumbar flexion or standing with slight lumbar flexion. Now in herniated lumbar disc, all these 4 points are possible or not. Let's figure it out. So point number one, yes, there are chances acute injuries happens because of lifting something heavy from the ground, so that is possible. Option number two, bilateral radiculopathy, yes, that also again is possible. Yes, I know that most of the time it is unilateral radiculopathy, but sometimes it can be bilateral also, so that I will say that might be and mostly possible. Option number three, which states that any lumbar movements are causing exacerbation of the pain. Now yes, that is again pretty possible because this is an acute case and lumbar disc herniation is there, especially when you're putting stress over the disc, it can cause exacerbation of the pain. So yes, that is possible. Option number four, which is saying that you feel comfortable when you are sitting down with lumbar flexion or standing with lumbar flexion. So that also again makes sense because in that particular position, we are reducing stress over the disc and that might give some relief of the symptoms for the patient. So in this, I feel that option number A itself is the correct answer, but without seeing the other three options, I am not confirming whether A is correct or not. So now let's check option number B. Option number B is saying facet joint syndrome. Now facet joint, whenever it is involved, there will be locking of the joint. We will see that there will be restricted range of motion. And here in the question, nowhere it is mentioned it is restricted range of motion. Point number two, if the facet joints are involved, we will find out that radiculopathy is not going to the lower limbs. Yes, might be sometimes it is present, but it will be locally present. So going in the lower limb with facet joint dysfunction is quite not matching over here. So with these 2 points, I can say that this option definitely is not correct option. So option B easily eliminated. Option C says that ankylosing spondylitis. Now ankylosing spondylitis is a condition, we also call it as bamboo spine appearance, in which the spine gets fused again. Okay, so disc is also getting fused over here. In this situation also, very rarely we will see the radiculating pain to the lower limbs. Plus the movements will be restricted over here. Here nowhere again it is mentioned that movement is restricted. Patient is here able to perform the movements. So this option also easily eliminated. Option number four, now this gives me some hint that SI joint dysfunction might have some problems like this. Now SI joint dysfunction, what happens? It can occur because of the strain when you are bending forward. Okay, so that is one possibility which is given in the case over here. Option number two, radiculating pain. Now radiculating pain in both the lower limbs because of SI joint dysfunction, again it is pretty much not possible. It is dicey situation. Okay, because SI joint dysfunction, mostly the pain will be in the local region, it will not radiculate. Plus, we have been given that when patient is sitting in flexion position, patient feels comfortable. Now here is a catch. When SI joint dysfunction is there, patient will more comfortable when patient is moving more or walking rather than sitting in one particular position or standing in one particular position. So that point is not matching. That is why I will say this option is also not correct. We can easily eliminate this option. And yes, as I suggested, the option number A looks more promising, and yes, that is the only correct answer over here. So if you selected this option as your answer when you saw this question, Kudos to you, congratulations to you. And in case if you could not guess the correct answer, no worries. I am sure that now after listening to this reasoning, you know the correct answer and you have understood how we can reach to the correct answer. For more such questions and to upgrade your assessment skills, don't forget to watch the Physio Quest series available on the channel.